37-year-old man is evaluated for fatigue that started about 3 weeks ago. He has a history of HIV infection diagnosed 7 years ago and is compliant with his treatment. CD4 count is 350. His partner passed away from a hematological malignancy, and he is worried that his fatigue may be connected to a similar pathology. Physician explains that there is an increased risk of certain kinds of lymphoma in HIV positive patients. Which of the following condition is the patient most likely to develop? Burkitt's lymphoma, diffuse large cell B-cell lymphoma, follicular lymphoma, small lymphocytic lymphoma, extranodal marginal zone lymphoma. Which of the following? So this patient is having HIV, and they are asking which of the following kind of cancer is common in HIV. So the answer is diffuse large B-cell lymphoma. This is a common kind of cancer in HIV patients. You have to just remember this. Burkitt lymphoma is seen in EBV. Epstein-Barr virus is most common infective agent leading to Burkitt lymphoma. Diffuse large cell lymphoma is seen in HIV, and extranodal marginal zone lymphoma is seen with H. pylori, maltoma basically. It we call as maltoma H. pylori.
Thanks for watching. Please give a thumbs up and subscribe for more.